Hi, and welcome to Chapter 15, Emerging Infectious Disease. Some of the highlights that this lecture will cover include the emerging versus re-emerging of infectious disease and the factors that influence it. We will also cover recent cases of emerging and re-emerging infectious disease and methods of prevention and control. Question: is the following statement true or false? Factors that influence the emergence or reemergence of infectious disease are multiple, complex, and interrelated. This answer can be found on page 282 of your textbook. There are 13 factors that contribute to the emergence of infectious disease. These factors are complex and interrelated. Emerging infectious disease. Emerging infectious disease is defined as newly identified, clinically distinct infectious disease or the reappearance or reemergence of a known infectious disease after its decline, with an incidence that is increasing in certain geographic areas or in a specific population. Health protection and disease prevention among the U.S. population requires global awareness and collaboration with domestic and international partners to prevent the spread of infectious disease. Factors that influence the emerging of infectious disease. The factors that contribute to the emergence and reemergence of infectious disease are listed on the slide. Please refer to page 282 of your text for more information on this topic. But the factors that are listed are microbial adaptation and change, human susceptibility to infection, climate, changing ecosystems and human behavior, travel, technology, and industry, and lastly, the lack of political will and breakdown of public health infrastructure. Recent emerging and re-emerging infectious disease. Some of the most recent and notable cases of emerging and re-emerging infectious disease include the SARS epidemic, avian influenza, Lyme disease, and the West Nile virus. The blue circular cell at the top of the slide is an image of the SARS virus. The bottom left is the West Nile, and the bottom right is an image of the avian flu, and these, again, are just for your knowledge and are not going to be tested on. Tuberculosis is a recent emerging and re-emerging infectious disease that we will discuss. TB is caused by Mycobacterium tuberculosis that is spread from person to person through the air when the infected person coughs, sneezes, speaks, or sings. TB is considered a droplet nuclei that can remain suspended in the air for several hours. Signs and symptoms of TB include a low-grade fever, night sweats, a cough that lasts for more than 3 weeks. A person may not be contagious even though they have a positive TB test. How can this be? This is known as latent TB. Those with HIV should be tested for latent TB, as a weak immune system can lead to the active form more quickly. Those at risk of acquiring TB include the incarcerated population, those living in homeless shelters, and those living in inner city and crowded areas. Treating latent TB is the cornerstone of disease elimination. Medications for treatment include ionazid, rifampin, and ethambutol for approximately 4 to 7 weeks, along with direct observed therapy. This involves observing the patients taking their medications for compliance. Direct observed therapy would be the responsibility of the public health nurse. Please view the link from the CDC where latent TB is compared with the active form of tuberculosis. This way you can get a better understanding. The Ebola virus and Zika virus. Within the past year and a half, we've heard much about the reemergence of the Ebola virus and the emergence of the Zika virus. The Ebola virus first appeared in 1976 and made headlines again in 2014. hitting a little close to home. The Ebola virus is spread through direct contact to broken skin or mucous membranes with blood, secretions, or other bodily fluids from an infected person. Ebola symptoms may include fever, muscle pain, vomiting, and bleeding. It can take up to 21 days for the symptoms to appear. There are 55 Ebola treatment centers located throughout the U.S., including Metro Hospital in Cleveland. Prevention is aimed at reducing transmission through the use of personal protective equipment and hand hygiene. The Zika virus, first discovered in 1947, is the most recent public health concern, especially for pregnant women, because it has been linked to severe birth defects. The Zika virus has been reported in Florida and is transmitted by mosquito bites. It may also be transmitted through sexual contact. This slide depicts the symptoms of the Zika virus. These include fever, joint pain, rash, and conjunctivitis. Symptoms may last a few days up to a week. Prevention is aimed at reducing the risk of mosquito bites or avoiding them altogether and practicing safe sex. Visit the CDC link provided and explore the various content information on the Zika virus. Again, this information provided in this website is for your knowledge base, and I would not be testing on it. In conclusion, I hope today's lecture provided some insight into the emerging and reemergence of infectious disease. Prevention in any of these cases is aimed at health promotion and providing education to the community and populations affected. In most cases, basic hand hygiene, protective clothing, covering your mouth, and safe sex practices would reduce the risk of transmitting the disease. The emergence and reemergence of disease is a concern, as we have discussed with the Ebola and Zika viruses. It is important to remember that those with HIV are susceptible to latent TB and should be tested before it becomes the active form. In public health nursing, we need to always be aware of the most recent emerging and reemergent diseases so that we may help our communities stay informed and protected. That concludes our lecture for today. If you have any questions, please do not hesitate to see me. Thank you and have a great day.